All right, welcome back to the Gut Health Dialogues. Today we have a great guest. I'm super excited about this conversation. It's Dr. Navidi, and he's a licensed clinical psychologist and one of the founders of GI Psychology, a multi-state center specializing in helping patients with GI disorders and chronic pain. Dr. Navidi oversees training and outreach at the practice. He's also one of the founders and past president of the Northern Virginia Society of Clinical Hypnosis and a hypnosis trainer for ISSTD. Dr. Navidi has given talks about GI disorders and chronic pain to organizations around the country, such as UNC School of Medicine, George Mason University, Georgetown University Grand Rounds, Innova, various podcasts, television, and various state academies of nutrition and dietetics. So welcome.
Thank you. I really appreciate being on, and I'm really looking forward to our talk. I think we have a lot of common interests in this field.
Yeah, absolutely. One of my colleagues has a podcast and she had a different guest on, but this person was a GI psychologist. I'll have to find out who that was and tell you. I can't remember. And I remember
community, I might know them.
Okay, yeah, and I remember thinking, how did she find a person like that? I need to find a person like that, because even just for our patients, because there's such a close alignment between what I do helping patients with their physical health, and then there's this whole mental, emotional piece that's critical to their recovery.
And I love working with dietitians because I don't do and I don't know what you all know, and vice versa. I think it's a wonderful team effort between dietitians and GI psychologists.
Yeah, absolutely. Because I see the gut-brain connection as such a foundational, like if we were to get to the most bottomest root of the problem, I feel that's there at the bottom, because our modern lifestyles are just so stressful, right? Compared to how we're designed to be. So I think it's foundational. And so what dietitians do, especially functional nutritionists, like those of us in my practice, we help people rebalance the problem. So now you have problems with your gut. You might have inflammation, microbial overgrowth, microbes out of balance, bacteria out of balance, food sensitivities. Those are all real physical problems. So we can help fix a lot of that. But then if you're still driving those problems because you're still in a anxious state, your nervous system is now trained to be stressed, then it's just going to be a vicious cycle, right? It's just going to all come back. So that's where it's so important to treat holistically. And that's where you guys come in. And I'm curious on your take, if you feel like it is symbiotic, or do you feel like you can just address the nervous system and everything else will eventually take care of itself?
That's a good question. I'd say both. I think, just for example, there's some patients that'll come to see you and you're going to use the tools in your toolbox and they're going to be fine. Like they won't have any problems and they're going to be good to go, done. And then there's a certain percentage that you're going to do everything that you can do, and there's just a piece of it that doesn't respond in the way that you might want, or in the way that they might want. And I think that's where that missing piece is the brain gut connection and changing the way that our nervous system interacts with our gut. And it's usually a piece that people have not addressed because it's just not well known that it plays such a powerful role. And so I think what I just described on your side applies to us too. So there's a certain percentage of patients that are going to come in and that's all they're going to need is that brain gut rebalancing, shifting that nervous system, and they're going to be good and they won't have any trouble either. And then there's, again, that percentage that needs maybe that functional dietitian piece, needs that microbiome work done. You know what I mean? All the stuff I don't really know that. I'm just like, I know of it. So again, I think these two work well together.
Yeah, and I think it just depends on which component of their problem is driving their symptoms the most. And for everybody, that's going to be different. And how severe is it, and so forth. So, getting started then with this conversation, maybe we could start with, could you explain what disorders of gut brain interaction are?
Yeah. So it's a newer term. It used to be called functional GI disorders. And functional, I think they changed it because functional didn't really tell us all that much. It's okay, functional. What does that mean? It means the function isn't working right. Okay. Like it's just not very much information. So they changed it to disorders of gut brain interaction, DGBI. And what that's saying is that the way the brain, the nervous system is interacting with the gut, so maybe the enteric nervous system, maybe through the vagus nerve, the way that interaction is happening is dysfunctional in some way, and it's causing symptoms and it's causing problems. And there's a number of disorders that fall under that category. And it could encompass any number of symptoms from like lower GI, where there's IBS, there's like pain, there might be constipation, diarrhea, things like that, or might be upper GI, functional dyspepsia. People are feeling bloated. They feel like the food isn't moving through well. They feel really uncomfortable. Might be different types of GERD and reflux that are happening. There's about 20 or so different disorders that fall under DGBI, and they can encompass a lot of different symptoms. But what unites them all is that when they do the standard test, they're not going to find anything wrong. They're not going to find inflammation. They're not going to find ulcers. They're not going to find it's fructose or gluten sensitivity. They're going to rule out all these things, which can be very frustrating. And at the end of it, if you have a not so good doctor, the doctor will say, everything looks good. You'll just have to live with it. If you have a good doctor, then they'll maybe refer you to Alyssa or myself and work on that brain gut connection, or take a look at the microbiome and see what's going on there.
So, is there a test? Is there a test to diagnose a disorder of gut brain interaction?
Yeah, there's not one test. What they have is you want to go to the doctor because you want to rule out these certain danger signals. And then once they rule those out, they can look at history and they can look at your symptom presentation and how it shows up. And they really can make a diagnosis at that point. Once they rule out the danger stuff, they get a good history. Back in the day, they had to do a lot more. They usually have to scope people. And what we found is that was overkill. So people would go for years getting a scope and getting tests and going to other doctors. And eventually they rule everything out. They do it twice. And then years later, they're like, okay, you have IBS. Now they can do that much quicker. They have better ways to figure it out, but it isn't one conclusive test.
So, it's still a diagnosis of exclusion, like IBS in general.
Yeah, it's still a diagnosis of exclusion, but they've gotten better, I think, at excluding things faster.
I think one thing that's important to understand is how the brain affects the digestive system, right? Because, like in our initial conversation last week when we met, you were saying it's just not intuitive. People don't always think about the brain when they're thinking about their gut issues. So, what is that connection?
If we can think even just at a nervous system level, right? We've got sympathetic and parasympathetic modes that our nervous system can go into, and which are called fight or flight, right? Fight or flight reaction. And then the other one, we could even call it rest and digest. So parasympathetic mode is like rest, digest, you're feeling chill, you're feeling good, digestion is working well. Fight or flight, the body is getting ready to really exert some energy to try to survive. So because of that, it's deprioritizing digestion. So digestion is naturally not going to work as well when we're in fight or flight mode. The problem is a lot of people in this modern day are walking around in this low grade fight or flight mode. And I see this all the time in my practice. Someone will come in, say, how's it going today? How you feeling? Oh, I'm feeling fine. And then we'll do a session of hypnosis right? And maybe it's just a very simple, straightforward hypnosis, working on teaching them how to relax. So we get done, they open their eyes, and they're like, wow, like I didn't realize that I was so tense because I feel so relaxed now. Because before we did the session, if you had asked them, how tense are you feeling? Oh, I'm not feeling tense at all. I'm very relaxed. But then you go through this process and now they know what relaxed feels like. And it sets them back because they've gotten so used to walking around just in this low grade fight or flight mode.
I think that's so true. I hear it with my patients too, because I'll talk about this, I'll broach this topic. And some people will admit they're stressed, they're anxious because they are. Other people, they think that if nothing bad that's major that stands out has happened this week, or nothing overwhelming is going on, that they're not stressed. But it's just our modern lifestyles that we have so much that we're dealing with. We have so much to worry about. And that's a bit unnatural, right? Because we used to live in smaller villages. We didn't have access to the world's problems. We didn't have a million things to juggle. Yeah. Yeah. We're not really meant to be in this state, or our system's not adapted to it.
Yeah, even something as simple as, I think it was a few weeks ago, and it's just a regular week, going through my week, and I realize that I'm like, every day I'm aware of my email level. And whenever I look at it, I can see it creeping up because I've got all these meetings and I don't have time to go through all these emails. And even just that in the side of my mind, always being aware of it and feeling that stress building up through the week as I see that number going up and up. At any one time, if someone asked me if I was stressed, I probably would have said no. But in actuality, if they'd looked at me physiologically, I probably would have been.
Yeah. And I like how you said low grade, because it is just like in the background, your to do list is piling up. And if you could just get some things done, your whole day would be better.
Yeah, if I could just do that, if I could just do that, right? But you never can just do that because there's always something else to do.
Yeah, yeah, absolutely. We don't know we have tension too, because I deal with neck and upper back tension. It's caused some weakness in my right hand, and I'll go to the chiropractor, and anyone that touches me says, "Wow, you're so tense." Yeah, and I don't feel tense at all. And I'm trying to relax. My muscles are just tense. And so I'm constantly heating and massaging and stretching just for the last year. And still I'll go in and they'll say, "Oh," and I'm like, "I know."
And it's interesting that gets into, okay, who's vulnerable to these DGBIs? Obviously, like anybody can get them. Anybody can get them, but certain folks are more vulnerable than others. And it's the people, anyone who's got an anxiety disorder, who's got a history of trauma, who's got any history of eating disorder, or who's on the autism spectrum. These are these four groups that tend to be more vulnerable. So you can see if you've got somebody who's really anxious in their life, it doesn't mean they automatically have one of these problems. But if you're seeing that someone who's really anxious is having GI problems, it's very likely that it might be related to that brain gut connection.
Yeah, that makes sense. And just to reinforce how that connection works, so you mentioned the fight or flight, then we deprioritize digestion. So because the brain normally it controls how quickly food moves through, like how many enzymes you produce, how your immune system is going to respond, and all of that.
Yeah, and I think that's like at a broad level, and there might even be more subtle reactions when we're stressed because, or not so subtle. Who hasn't had that reaction where, let's say you're sitting in at work and it's a meeting, and then your boss looks over at you and says, "Hey, Johnson, why don't you give us a presentation on what you've been doing lately?" Stomach flips. I'm not ready. Oh my gosh. But we feel it immediately in the stomach. What does that tell you? That tells you that Something happens in the brain, it immediately gets transferred into the stomach and you like this clenching lip. So there's this broader reaction if we're in that fight or flight, but there can be very intense and immediate reactions too that come directly from the brain.
And I know a lot of my patients, it's not everybody, but like they'll run to the bathroom if they have something like that. And that can actually make them very fearful to even participate in things because if that happens, they're afraid of having an accident.
Yeah. And that gets into this whole part of things like IBS and these gut troubles where their lives begin to constrict and get smaller, and the activities that they can engage in, the places they can go, the foods they can eat. You see this when by the time they've come to you, they're so restricted in so many ways because of these problems.
I remember a patient, he's all better now, but he came to me, he was eating chicken and rice, and he was driving around a motorhome as his main vehicle of transportation, not for
Oh,
vacationing,
wow.
just so he'd have a bathroom 9 feet away
Yeah.
to pull
Wow.
over and use it. Yeah. And it turns out he had SIBO and we cleared it and he's able to eat normally, not always the healthiest, but he can eat whatever he wants and he's fine. Yeah. I notice a lot of patients with these gut issues are like anxious. You can feel it coming off of them. And certainly having these issues are not helping with that. But I wonder how much of it's the chicken or the egg. Does it even matter? Because now we're here.
Yeah, I think it's both because obviously having a GI problem is anxiety provoking. It's scary enough to, let's say, do some public speaking, then to also have in the back of your mind the idea that in the middle of your speech, you might have to run off stage and find a bathroom. That's terrifying, right? So you've got an already probably anxious person who's now got a disorder that's causing them more anxiety, and it just fuels itself, right? Yeah.
And the stomach is the second brain, right?
Yeah. Yeah. And so one of these facts, it's like the majority of the neurotransmitters in the body are created in the gut,
Yeah.
right? But other stuff,
90% of serotonin, I think.
yes. Yeah, that sounds right. And but then the other side too, it's because when we feel emotions, there's a certain percentage of the population that will feel it in their gut. They feel their emotions in their gut because we've got this little brain that's in tune with our big brain. Now, there's other people that they'll feel their emotions in their head, meaning they'll get like headaches or things like that. Other people will get muscular skeletal issues, tightness or pain and things like that. So we express our emotions in our body in different ways. So we're not all the same and we're all wired differently, which is to me is fascinating.
It is fascinating, especially when you look at how, in general, in healthcare, we're separating the two. It's like you go, this is your mind, this is your body, two separate things, but that couldn't be further from the truth.
And that there's this stigma that people have. Like they'll say things like, oh, so you're saying it's all in my head, which if you really step back for a moment and just think about that statement, it's all in your head. Let's say somebody has a lot of pain and they discover, they do all this testing, they, okay, there's nothing wrong with your stomach. Your stomach is healthy. What we're seeing is this interaction between your brain and your stomach. And then sometimes patients will respond by saying, wait, so you're saying it's all in my head? And if you think about it, there is no pain if you don't have a brain, meaning all pain is expressed in your brain. That's not saying anything interesting. What's the interesting part is what is the cause of the pain? Because pain that's being caused by the interaction between the brain and the gut feels just as real. It feels no, you can't tell the difference between pain that's being caused by, let's say, an ulcer or like inflammation. You can't tell from an inside your body perspective. But there's this stigma that's, oh, you're just making this up then.
Hmm. Yeah, I definitely see that too. When the doctor says, go to a therapist about this or go to a psychologist about this, sometimes the doctor means it correctly. Sometimes the doctor does mean it. So the patient can feel offended by that. Sometimes it's a misunderstanding, sometimes not so much.
And I think sometimes it's also about like how they explain it to them. There was a one doctor who was super well-meaning, really cared about her patients. And at the same time, when she would refer her patients to us, she would say, I think this would be good. It'll give you somebody to talk to. Very innocent statement, but the implication is that their problem is being caused by just like loneliness or not having enough people to talk to. And the patient's response usually is, look, I have people I can talk to. That's not my problem. And in reality, that's not why someone would be referred to someone like myself or my practice. They would be referred to us to learn very specific skills and how to utilize them to change this negative feedback loop and to interrupt it in various ways.
Let's talk about those strategies. So it's not a talk therapy fix. That's not what we're talking about. We're talking about clinically verified strategies that you use. So can you tell us about those?
I'm glad you used the word clinically verified because it's absolutely right. There's a tremendous amount of research, hundreds of studies over 40 years showing that these treatments are effective. And what are the treatments? It's a very specific kind of cognitive behavioral therapy, which many people might have heard of. But just to be clear, it's a very specific type of that not many people are trained on. And then the other side is clinical hypnosis. And you're like, okay, why are these being used? How could they help? Because I think if people understand three things, they can understand how these treatments help. So the first would be that what is shared by all these GI brain gut disorders is something called hypervigilance. So their brain is always thinking and scanning and looking for trouble in the gut. Or if their problem is with reflux, they're looking for it in their chest or their throat. Or if it's a problem with dyspepsia, they're thinking about their bloating and they're always worrying about it. And then when they find something, the brain catastrophizes. And that's what you were talking about, the guy who went everywhere in a trailer that had a bathroom. It's a great example of catastrophic thinking. It's okay. If something happens, I'm not going to be able to find a bathroom. And if I can't find a bathroom, then I'm going to have an accident. And then like it goes on and on. So you've got this anxious way of scanning and then thinking about things. And then that feeds anxiety and stress down into the gut. And we already talked about how that brain gut connection, it's going to respond to that anxiety and stress and it might cause more symptoms. And then those symptoms, the sensations get sent back up to the brain. But there's one other piece, and that's called visceral hypersensitivity. And that's where those sensations get amplified and distorted and made often into pain or discomfort from something that maybe was relatively benign. And so now you've fed back into this anxious brain all these amplified and distorted signals. And of course, that anxious brain is going to freak out about it and send even more anxiety down into the gut. So it kind of spirals.
Yeah, I see the hypervigilance all the time. And unfortunately, we might promote it sometimes as health professionals because we're asking for them to describe their symptoms so often and track their progress. And to the point where even once everything's fixed, they'll be like, I had two bowel movements today. Is that okay? Should it be one? Wait, I had some gas. Is something wrong? Is all the problems coming back? So yeah, hypervigilance. And then the visceral hypersensitivity. So that means that the normal amount of bloating that one person might not notice, somebody else feels as intense pain, right?
Yes. Yeah. And I think for a lot of people that can be hard to believe that this exists, that the brain has that ability, and it really does. It has the ability to ramp it up or ramp it down. And we can see that most powerfully when we use hypnosis because it's one of the only tools that I know about that can directly turn down that visceral hypersensitivity. because they've done these studies and it's almost ubiquitous amongst IBS patients that they have this visceral hypersensitivity. They've done some like balloon studies to demonstrate it. I'm not going to get into the details, but it's common across the disorder. And they're getting normal sensations, maybe feeling hungry or maybe feeling full, maybe feeling like a normal amount of gas. And that's being transformed into pain or intense discomfort.
Yeah, and why is that?
I think it's a protective mechanism. So the brain is designed to keep us safe. And for various different reasons, the brain can, over time, learn that a part of the body is a problem or dangerous. And so a classic example is something called post-infectious IBS. So somebody has a really nasty infection. Maybe they're throwing up, they've got diarrhea, it's terrible. It lasts for a week or so. And then the infection passes, but a lot of the symptoms stay. And so we were struggling, okay, what's happening? What's happened is the brain has locked in on the gut as a problem because it spent so much time miserable and in pain that it's decided, okay, this is a problem. And so when it's decided an area of the body's a problem, what it wants to do is pay very close attention to it. So it ramps up the signal. And the way that the brain sends the message for us to pay attention to something is through pain. Pain is a signal that says, pay attention to whatever it is that's in pain, because either there's damage or there's going to be damage. That's how the brain gets our attention. So it locks in and it turns up the dial. So it's really forcing us to pay attention because it's learned from this experience that this area is dangerous and it doesn't want to get surprised again.
That makes perfect sense. If it's like you keep having maybe a physical insult to a certain spot of your body, it would get sore. It'd
Yeah,
be sensitive.
exactly. It'd be sensitive and it would say, okay, keep an eye on me because I'm vulnerable, I'm tender. And so a little touch, it really hurts because the brain is protect this area, keep it safe, pay attention, don't forget about me.
Wow. Yeah. Yeah, and then that is one of the biggest problems with IBS. So you mentioned, and I hadn't heard this before, that the cognitive behavioral therapy for IBS is a specific type. Can you talk more about that?
Yeah, and I think that leads to a good amount of trouble because a lot of doctors out there have read in the research saying, oh, okay, cognitive behavioral therapy, it helps. And so they're doing the right thing. They're saying, okay, go see a CBT therapist. The patient goes out in the community, finds a CBT therapist. If they've got an anxiety disorder or depression, the treatment's probably helpful, at least for that. But your standard CBT therapist doesn't know what to do with IBS. They don't know what to do with functional dyspepsia or cyclic vomiting syndrome. So they don't know how to apply this general tool, cognitive behavioral therapy, to this very specific problem. You need specific training for that. And a lot of times what happens is people will come to us and we'll say, okay, we're going to do CBT and we're going to do clinical hypnosis. And they say, I've tried that CBT thing. That didn't help me at all. And what it is, they didn't try the specific protocols that are needed.
Okay. And so how does it work?
Yeah, the CBT side or the clinical hypnosis side?
I want to talk about both, but let's start with CBT.
Yeah. So you see, first off, there's different components to the problem, right? On one side, there's the thinking style that you need to address. So you need to address that hypervigilance and catastrophic thinking, but they're not generalized. They tend to be very specific. A hypervigilance about the body, a catastrophic thinking style about the body, about the gut. So you address that, then you need to also address avoidance. Avoidance is a big enemy, and you see a lot of avoidance. So as we talked about, you're avoiding situations, you're avoiding places, you're avoiding foods, you're often avoiding your own internal sensations. So we call that interoception, the internal feelings in our body. People can develop a fear of their own internal feelings. And so we want to systematically address each of those different components, but in a certain order, because if you go in the wrong order, it doesn't work. As an example, if you try to reintroduce foods first, you'll usually fail until you calm the system down. Because if you try to reintroduce some of their foods before you've calmed the system down, they're still going to have a bad reaction to the food. And they're going to think that this food is like bad for them. And on our side of things, we call that conditioned food sensitivity, where they've had this learning that this food is bad. So they believe it. So it's a self-fulfilling prophecy.
Yes. Yeah. We definitely see that. And a lot of these elimination diets, the way they're presented is here's the diet, eliminate, reintroduce, and nothing is done about the root of the problem. And people either reintroduce and then they're getting all their symptoms back, or they start to do that, they see the symptoms, they avoid, and they stay stuck in that restrictive phase, which was they're never supposed to do, but they are stuck there because they're reacting to everything. And I also see it with supplements. We see it pretty commonly. I can think of one person right now that I'm working with, and it's sometimes you need nutritional supplements to help your system along, whether it's to soothe or calm or get motility going, things like that. And they'll be afraid to take anything. And if they do get a reaction or they feel like it caused a symptom, now they don't want to take anything else. So now they don't want to eat any new foods. They don't want to take anything. So I think that's the avoidance you're talking about. And then they don't want to try anything. So it's like we're stuck, at least from my standpoint. But that's when I need to send them to you. Because we can't do what we need to do until that calms down.
Exactly. And that's why I think it's such a good, working relationship, where it can be so frustrating for you all when you can just see it. You can see that there's this tremendous anxiety, that there's this conditioned food sensitivity, and that there's nothing to indicate that this is a food that's bad for their system. But they're reporting that they're having reactions to it. And they're not lying. They're not lying. They are having reactions to it, but the reactions are more so due to that brain gut connection than it is to that poor food. The food didn't do anything wrong. It's fine, but it's that brain gut. Yeah. I just started with a little guy, and he's avoiding so many foods, and he's got this instant pain reaction when he eats a food, which clearly is not related to the food, because his system hasn't even had a chance to start to digest it in any way. But he's having a reaction of pain almost immediately. So that's a really extreme example.
I've heard people talk about a reaction to just drinking water.
Wow.
Some people will have pain just drinking a sip of water, and you think, okay, that's not doing anything. Your body's made of water. Yeah. Yeah.
If you're allergic to water,
Yeah.
you've got bigger problems.
Yeah, exactly. It's a real issue. The more sensitive a person is physically, and then it's a feedback loop with their anxiety. And again, if we're in the place where you can barely eat anything, you can't take any of the supplements, the treatments that you actually need from a physical standpoint. Yeah. So where do you go?
Yeah. And so you often, when you see visceral hypersensitivity, it's confined to a certain part of the body. But sometimes it can actually almost encompass the whole body. And this is what we call central sensitization. And it's a really nasty situation where they're likely to develop different pains in different parts of their body that can just show up randomly. They're going to be getting headaches. They're going to be getting gut problems, because it's like their whole body, their whole nervous system is on high alert all the time, looking for danger, whether the danger is in the muscle, the danger is in the head, the danger is in the stomach. And these are also going to be the people who are going to be incredibly sensitive to any medication they start, because anything they start or any new supplement, it's going to create a feeling that their brain is super sensitive to and is amplifying and distorting. So they're the ones who are going to have side effects from almost every medication that they take.
Yeah, yeah. And we see that a lot. We see that in people with histamine intolerance. There's obviously a strong tie between the brain and the immune system. And so it's all interconnected.
Yeah. And that's even more complicated where you talk about psychoneuroimmunology, right? The whole field of the interaction of the brain and the immune system. It's, oh my gosh.
It gets so complex. Yeah. The deeper you go, the crazier it gets for sure. But we want to simplify this for people as far as solutions. So, what you described with cognitive behavioral therapy for digestive issues, you said you addressed the avoidance. What were the other two pillars there?
Yeah, so we had the thinking style, right? Then we have the various types of avoidance, and it could be behavioral or food or perception, so that their internal feelings. And then we want to just shift them from, we talked about that at the beginning, that low grade fight or flight to more of a parasympathetic rest and digest. And sometimes that's called like relaxation training. And it's a funny term on the outside of it because you're like, people need training to relax. And they actually do. Just take your shoulder muscles, for example. Like you try to relax, but they're not having it, right?
It's an oxymoron, right? You try to relax. I'm gonna relax. That relaxation training, is that where you're supposed to tense and then relax?
Yeah, so that can be a tool. It's a wonderful tool. It's called PMR, progressive muscle relaxation. And there's different types of it. So the original PMR was created in like the 30s. And it was this really cool idea. And this doctor figured out, he was like, when I tell my patients to relax, they can't do it. But what if I tell them to tense first and then relax? And then tense again and then relax. And so he systematically went through their whole body, multiple rounds, having them do that. And at the end of it, they were just like a puddle. They were like super relaxed. And he's, oh, I think I'm onto something. And so since the 30s, they've been doing that. And that's like the physical version, which I think is very powerful. But then there's more of a mental version where it's more like you just go through your body systematically and just do it with the intention to relax. So it's okay, we're going to start with our hands. Okay, let your hands feel relaxed. Move to your forearms and move through the body. And that's also sometimes called PMR also, but the OG PMR is the tense and the release.
Interesting. I'll have to try it. I've been afraid to tense any more than I already am.
Oh, no, no. Trust me. Actually, I can send you a good recording on it. It's like about 20 minutes. I'd say the majority of my patients that have done it have really benefited from it a lot.
Yeah, I would appreciate any help I can get. I've been working on this issue for a year with my tension. Now, I do want to talk a little bit about the hypnotherapy piece because I think there's a stigma there too. And that's the other big modality that you find to be helpful with this population.
Yeah. And hypnotherapy, clinical hypnosis, it's such a sad situation. And I say sad because it's an unbelievable therapeutic tool. So as I've got this bigger practice, GI psychology, right? And I'm the one who's in charge of training at the practice. And whenever a new clinician comes in and we're teaching them about the gut brain and we're teaching them about GI stuff, we always teach them about clinical hypnosis. And so many of them, on being introduced to it as a therapeutic tool, are just blown away. Like light bulbs come on. It is such a powerful tool. And it's so sad to me that it's gotten all wrapped up into this entertainment hypnosis world. My family's so nice. Like my kids will get mad for me whenever a new movie comes out that has hypnosis in it because it's always portrayed in such a like, I don't know, it's either mind control or it's some weird dark magic or something like that. So if it's not all that junk, what is it? It's simply teaching someone how to do things that they already do naturally. And what are we teaching them to do? We're teaching them how to go into a state of trance. And trance is a natural state of human consciousness. We all go in and out of trance. Pretty much every time I get in my car and drive to my office, I'm going into trance. So I've got a couple teenagers. Anytime they're holding their phone, they're in trance. So trance
Is it like when you zone out?
Yeah, it can be zone out. It could be when you zone in.
Like meditation?
Meditation involves trance, or even if you're just working on something and then you're done and you're like, oh, it's been an hour already. Like you lose yourself in things, you get absorbed. These are all examples of trance. But it turns out that when people are in trance, they also have this increased ability to have a more powerful mind-body connection. It's really hard to access it like on their own. So an example, I'll do a little test to see if somebody's a good candidate for hypnosis. And one of the tests is you teach them how to, it blows people away, but teach them how to warm up one hand and not the other, just using their mind. And it's really neat because at the end of it, you have them put their hands together and one of them is a lot warmer than the other. But it's this really clear demonstration that your mind, when you teach them how to use it properly, has the ability to make these mind-body changes that they never would have been able to do consciously. Like consciously, just if you ask someone, make one hand warm and the other without doing, they're going to look at you like you're crazy. But using some of these techniques, it's not particularly hard. You can do it in about 2 minutes, 3 minutes, something like that.
Amazing. Yeah, no, that's amazing. This is also fascinating to me, especially my original major in college was psychology, and then I changed it. I could just geek out on this stuff for all day. It's so fascinating.
Hypnosis was what got me into psychology in the first place. I was a microbiology major. I was out of college. I was working in biotech. I was working in a lab doing yeast exocytosis and in another lab studying Alzheimer's genes like ApoE and things like that back in the day. Um, but I was reading about hypnosis and I was like, this is too good to be true. And like the more I read about it, the more fascinated I became. And I was like, okay, actually, I didn't even figure it out. My wife was like, you might want to think about changing what you're doing because you seem to really like this psychology stuff. And I don't know if you're in love with all this biotech.
The yeast cytology.
Yeah. No, she was totally right. She saved my life.
That's amazing. That's great. I also want you to tell us, because I'm sure there's people listening just thinking, sign me up. How can I access this sort of care, this very specialized, very holistic care? Tell us a little bit about your practice, where it's available, how it's available, and how it works.
So I was just in private practice in the DC metro area. And all the GI doctors in the area were starting to refer to me. And at a certain point, I was like, okay, I can't take any more patients. Who can I refer to that has this skill set? And the answer was nobody. There was nobody on an outpatient basis who had the skills necessary. And we decided to start this bigger practice called GI Psychology. So that's the website also. It's just gipsychology.com. And the mission of the practice is we wanted to make these treatments available to people on a much wider basis because there's only about 500 gut brain trained therapists in the world.
Oh my goodness.
And just IBS alone, you've got 45 million patients, all of whom could probably use a 3-month course of this kind of treatment and would really benefit from it. So I'm like, okay, that's a big problem. So we've come a long way. We've developed a curriculum now that we can systematically take a kind of a standard mental health therapist and train them up systematically to become someone who's capable of treating these kinds of disorders.
Wow.
And there's a lot of demand. Like, we're in partnership with the Crohn's and Colitis Foundation. We're putting out a group for, this is a whole other subject, I know, but for IBD patients, so Crohn's and colitis patients. We've got a group also for like DGBI patients also. So really, they just reach out. There's a free phone consult on our website. They can talk to someone who's clinically trained, and they'll answer all their questions, and they can figure out if it's the right treatment for them.
And you mentioned that you are in DC, but what you told me last week was you guys now have people in every state, right? You can treat people in every state.
Yeah, that was another big effort that we did, because we're like, okay, it's not accessible if people in every state can't get to it. So that was on the business partner side, and she figured out how to piece it all together so that we could see patients in all 50 states. And so it's a telehealth treatment in all 50 states.
Okay, awesome. So it's a telehealth services available in all 50 states. People go to your website, sign up for the free consult, and take it from there.
Exactly.
Awesome. Yeah. I love it. This has been such a great conversation. Maybe we can have another one in the future, because this is just such a great synergy. And I already have one patient in mind I'm going to refer to you guys, and there will probably be many more.
Oh, wonderful. Yeah. I think it's just a natural, great partnership is the kind of work that you do, functional dietetics, because these patients often need that piece also. And we each are doing things that the other's not doing.
Yeah. And we're doing things that the standard approach isn't doing, because the average person is going to think about going to their doctor, being referred to a gastroenterologist, and then what? And that's where it ends. And what I do is focus on the microbiome and digestive sufficiency. And you're focusing on the gut brain. And those are the things that are missing from the standard approach to these really complicated GI issues.
Yeah. And I bet you see a similar type of patient that we do, the one who's bounced around the medical system for too long and has eventually found their way to you.
Yeah, and some have been to very renowned practices across the country that you'd think that they'd get the best help there, but it's still a standard approach because it's a standard medicine facility, meaning medications, diagnostics, procedures, but not looking at the wellness aspect or any of the things we've talked about today.
Which is sad, because if you look at the ACG, so the American College of Gastroenterology, they have guidelines regarding treatment of IBS. The things I've talked about, these are not like pseudoscience on the side. They are written into the guidelines as standard of care for IBS patients. But I think it's a mixture of the patients don't really find out about it. And even if they did in the past, it was really hard to find someone who knew how to deliver that treatment.
Yeah, but that's all changing. So I think what you're doing is revolutionary. I really do. So good for you.
Thank you.
Yeah, that's amazing. Okay. Thank you so much for joining us. And we will definitely put all your links in the show notes so that people can find you.
Wonderful. Thank you so much.
You're so welcome.